Hello, and thank you for joining Contagion. I'm Assistant Editor Grant Gallagher, here with a review of our COVID-19 coverage from May 12th, 2020. There's been heated debate about how much testing is necessary to reopen as lockdown restrictions are lifted across the United States. The focus is often on production of as many millions of tests as possible, but there's a factor that doesn't often enter this conversation. That factor is a labor shortage. Today, we shared an interview with Dr. Rodney E. Rohde, a medical laboratory scientist from Texas State. Dr. Rohde talked to me about the need for more trained specialists able to accurately conduct SARS-CoV-2 testing. Few in medical school are aware of this vocational pathway, but those who pursue it are educated in a unique branch of medical knowledge and play a pivotal role in controlling infectious diseases both in pandemic times and otherwise. We also shared the results of a recent study on COVID-19 contact tracing. Contact tracing allows epidemiological response by not only notifying people of exposures so they can self-quarantine, but also understanding potential dynamics that led to exposure in the first place. Identifying the hotspots allows contact tracing to make an impact without having to take on the impossible task of tracking every new case of a virus, which has infected more than 4 million people globally. In other infectious disease news, a recent study suggests that conversations about PrEP with a clinician are the least common among adolescents with the greatest risk for HIV. One factor behind the limited uptake of PrEP in the United States is a predicament called the purview paradox. The purview paradox refers to a contradiction in which primary care physicians consider pre-exposure prophylaxis to be beyond their purview. But experienced HIV care specialists tend to work in contexts where patients are already living with HIV. So, the purview paradox is particularly present in adolescent HIV prevention efforts. Primary care physicians may doubt the ability of their patients to adhere to a daily medication, may have legal concerns about sexual health services being kept confidential, or may have reservations when discussing a younger person's sexual activity. We reported on a recent review published in JAMA Pediatrics that examined this issue and offered some recommendations for improving clinician engagement with adolescent HIV prevention. So, for more on all these studies, stories, and other infectious disease news, visit contagionlive.com. For Contagion, I'm Grant Gallagher. Thanks for joining me.